Hi, can a fitness trainer recommend steroids for his clients? I can finish up this video in a small one-word answer, but before getting in, I want to go into a little bit detail about this entire topic. As a fitness trainer, we are not intended to treat or diagnose any kind of disease or disorder. So this is our professional ethic. So we need to maintain that. We are not supposed to treat any disorder. For example, somebody comes with a back pain or a knee pain, we are not supposed to promise them we can treat your back pain or something. That is, treatment should be done by a paramedical doctor or a physiotherapist or a proper medical professional. We can take advice from them and we can tweak our exercise program to optimize their rehabilitation process. That is the thing, we can do that. Same thing, we are not supposed to diagnose anything. So if we are not able to do that itself, recommending a Schedule 4 drug is really a madness. So basically it's like steroids were Schedule 4 drugs. They use steroids in medical field to treat hormonal replacement therapy. The people who are lagging in their vital hormones, that's the sexual hormones, they use this as that's for infertility, sexual disorders, they are using it. That's a first function. The second function is it's like life-saving options. Somebody is having some kind of a life-threatening disease like tuberculosis or AIDS, they'll be having lots of muscle wastage. So this anabolic steroids helps them to retain their muscle and to prevent the catabolic activity happens because of their viral infection. So that's the second major purpose. The third purpose is what we do in professional bodybuilding or fitness industry is performance enhancement. If you look at the dosage protocol of a conventional therapy or a doctor in a prescription, it's never goes more than 50, 100 or maximum 200 mg of a drug for maximum 10 days period of time. It can be oral or injectable. The moment if we shift to performance enhancement benefits, we start the dosage somewhere around 750, 1000, 1500, and there are lots of random things going around online. People crazily using more than 2000, 2500 mg for a normal state level bodybuilding competitions. So that's a very big issue. Naturally, how much hormone gets secreted in your body? Steroid hormones, that is testosterone. Prominently we are speaking about testosterone. So it's like it is somewhere around 700 to 1000 nanogram per ml. I'm not exactly right, maybe you can cross verify. It's very minimal. Maybe if you look at it in a dosage protocol, it is not more than 5 to 20 mg per day. If suddenly a person is injecting with 750 or 1000 mg, which is somewhere around 100 times or 200 times more than their natural secretion, what kind of effects there happens in their physiological system? So to have a basic understanding towards these hormones, there are three different levels of hormonal or physiological activity happening in based on your hormonal system or endocrinal system. First thing is your neurotransmitter. Neurotransmitter is nothing but basic chemical signals which can be utilized by a brain to transmit some kind of positive and negative signals inside to maintain a proper health. For example, dopamine or endorphins, these are neurotransmitters. These are things inside your brain. Next level is neuropeptides. From neurotransmitters, it will go to the next level, neuropeptides. So the brain will send signal to your ductless glands to secrete hormones. Those were called neuropeptides. And the third level is your hormone. From the ductless glands, there is a chemical signal coming from there, and it will stimulate your vital organs like testes to secrete hormones. So it's the third stage of physiological system in your entire hormonal clock. I can say it's a hormonal clock. So if you are reversing the system by increasing the hormones, think of what happened to your neuropeptides, what happened to your neurotransmitters, and how does your body will react to this entire jerk of a huge amount of hormones. There will be a positive benefits, there are also negative benefits. So to understand this, so there are lots of chemical reactions and physiology involved in hormonal usage. So if you don't have a clear understanding towards it, please don't do it at all. Maybe yes, Bodybuilding is a sport. Some people prefer, they want to do it for their passion. That's fine. So those people who want to do it, I will be giving few tips for them. First thing is they need to do a proper blood work before getting involved into this kind of a performance enhancement drug usage. So normally there are lots of health risk associated in these days. It's like there are lots of gene factors which will enhance your cancer cells. There are most of the people these days, I'm able to find people in 20-25 years, they are able to find coronary heart disease, reason for coronary heart diabetes. There are lots of things out there. These things need to be first screened before usage of these hormonal replacement therapy or a performance enhancement therapy. So to understand this blood work, we definitely need a proper medical practitioner's help. So we need to properly associate with a proper medical practitioner, and you can very frankly, you can upfront tell your dosage protocol to them. Maybe they will be shocked, but anyway, in case of any kind of medical emergencies, they are the person going to come and help you out on this particular process. So this is the number one thing. Second thing is injection procedure. It's like most of the guys are randomly injecting too much of hormones in the same scar tissues that will lead to some kind of infection. And even I can say it's like you need to inject it in an injection spot. It's like your glute has a very big connection between your sciatic nerve, that is the nerve connected to your legs. Accidentally, if you are poking into your sciatic nerve, there are chances of getting paralysis is also there. So always take a paramedical doctor or a nurse support to inject these hormones. Again, I'll tell you, there is no, I'm not saying it from my heart to use it. Yes, you are young, you are in this age, you would like to do it for your personal passion. Do it for a short period of time, then come out of it. Don't make it as a permanent lifestyle. And those guys who want to start, don't start your hormonal usage or performance enhancement usage at very young ages. It's like when you are 20 or 25, it's like try to learn and know more about exercise science, nutrition science, and supplement science. Once you master all these things, start implementing these things. Within 3 or 4 years of consecutive training with proper nutrition and supplementation, I can tell you, I can guarantee you, you can reach your optimum genetic potential. Don't believe in drugs on a very initial stages itself. Once you reach your genetic potential, after that you can give one fair shot with a proper medical supervision. Without that, it's like getting into this, it's like without all this precaution, taking performance enhancement drug is like trying a bungee jump without a safety leash. So be careful with that. The final thing I would like to say is, it's like as a fitness trainers, we are not supposed to recommend these type of performance enhancement drugs to our clients. It is clearly illegal. I think I had provided enough quality information in this video, and I had answered your question also. If you like this video, please like it, share it, and subscribe to my channel. Thanks for watching.